Hey there, and welcome back to Health Tips 50, your go-to channel for real, practical health advice for adults over 50. Today's topic might surprise you. If you have heart issues, should you give up coffee completely? Or could your daily cup actually be helping your heart? You've probably heard both sides. Some say coffee is risky for the heart. Others claim it has protective benefits. So what's the truth? Before we dive into the facts, make sure to hit that like button, share this video with someone who loves their morning brew, and subscribe to Health Tips 50 so we can keep bringing you science-backed, age-friendly health tips every week. Is coffee good or bad for your heart? Here's what most people get wrong. If you're over 60 and wondering whether your morning cup of coffee is hurting or helping your heart, you're not alone. This is one of the most common questions I get from older adults. Is coffee actually safe for my heart? For decades, coffee had a bad reputation. People believed it raised blood pressure, caused palpitations, and increased the risk of heart disease. I've had countless patients tell me they gave up coffee completely in their 60s and 70s just to play it safe. But recent research tells a different story, one that might surprise you. Moderate coffee drinking, it turns out, is not only safe for most people, it may actually offer some protection for your heart. Why? Because coffee is packed with antioxidants, particularly polyphenols, natural compounds that fight inflammation and oxidative stress in your arteries. And since inflammation is a key factor in atherosclerosis, the hardening and narrowing of the arteries, anything that helps lower that risk is worth a closer look. A major Harvard study following over 200,000 people found that those who drank 1 to 2 cups of coffee per day had an 11% lower risk of heart failure compared to non-coffee drinkers. Another study, published in JAMA Cardiology, echoed the same. Moderate coffee drinkers, especially older adults, had better cardiovascular outcomes over time. Let me share my own story. I'm 67 years old and have dealt with high blood pressure for years. Like many people my age, I avoided coffee for a long time. But a few years ago, I started experimenting. Just 1 small cup in the morning. Black, with a splash of oat milk. No sugar, no syrups, no fluff. The result? I felt more alert. My energy during morning walks improved, my focus sharpened, and best of all, my blood pressure didn't budge. It stayed exactly where it was before. In fact, I started looking forward to that peaceful moment each morning. Just me, my coffee, and a quiet start to the day. So now I ask you, have you been skipping coffee because you were told it's bad for your heart? Or are you drinking it daily without ever thinking about its effect on your health? Here's the bottom line. Moderation matters. According to Dr. Frank Hu, chair of nutrition at the Harvard T.H. Chan School of Public Health, up to 400 milligrams of caffeine per day is considered safe for most healthy adults. But go beyond that, and you may run into problems, jitteriness, irregular heartbeat, disrupted sleep, or even elevated anxiety. Also, what you add to your coffee matters. A simple cup of black coffee is not the same as a venti caramel mocha with whipped cream and a side of pastries. That's not heart-friendly. That's dessert in disguise. So yes, if you love your coffee and drink it in moderation, it's likely safe and might even be helping you. But like everything else in health, balance is key. Coming up next, we'll explore what happens when you overdo it and why too much coffee
might quietly put stress on your heart before any symptoms appear.
Read the following text in a warm, calm, and reassuring male American voice, as if spoken by a trusted senior health expert around 60 years old. Speaking speed slightly slower than normal, about 1x. Tone caring, supportive, and easy to follow. Emphasize important health words gently without sounding dramatic. When coffee becomes too much, what older adults should know. Just because a little coffee might be good for your heart doesn't mean more is better. And for those of us over 65, that line between just enough and too much can sneak up faster than you think. Let's be clear. Caffeine is a stimulant. That's part of why we love it. It wakes us up, sharpens focus, and gives us a mental boost. But it also temporarily raises heart rate and blood pressure. For younger adults, this isn't usually a big concern. But as we age, our bodies metabolize caffeine more slowly, and our cardiovascular system becomes more sensitive to its effects. That means the same cup of coffee you handled fine at 30 might hit a lot harder at 70. Studies published in respected journals like Hypertension and Circulation show a consistent pattern. Consuming more than 400 milligrams of caffeine per day, about 3 strong cups of coffee, is linked to elevated blood pressure, heart palpitations, sleep disturbances, and even anxiety. And we know that poor sleep isn't just annoying. It's a real risk factor for heart disease, especially in older adults. Let me share a story from my practice. I had a 72-year-old patient who was drinking 4 to 5 cups of dark roast coffee every day. He told me it helped him feel sharp during the day, especially in the mornings. But he also complained of racing heartbeats, anxious feelings, and trouble falling asleep. At first, he didn't connect the dots. He said, "I thought I was just getting older." When we reviewed his caffeine intake and decided to cut it down to just 1 mild cup in the morning, the changes were almost immediate. Within a week, his heart rhythm normalized, his sleep improved, and the constant tension in his chest eased. He came back and said, "Doctor, I didn't realize coffee was sneaking up on me like that." It's a common story. So let me ask you this. Do you sometimes feel anxious, get a fluttering heartbeat, or struggle to sleep, especially on days when you've had more coffee than usual? That could be your body and your heart trying to send you a warning. Dr. Penny Kress-Etherton, a leading nutrition expert at Penn State, reminds us that caffeine tolerance varies from person to person. What's harmless for one individual might trigger serious symptoms in another, particularly if you're older or taking heart medications like beta blockers, diuretics, or antiarrhythmics. So yes, 1 or 2 cups of coffee can still be safe and possibly beneficial. But once you tip over that moderate limit, the risks begin to outweigh the rewards. This is especially true for anyone managing hypertension, atrial fibrillation, or heart failure. In these cases, your morning brew should be more of a mindful ritual than a reflexive habit. What matters isn't just how much coffee you drink, but when you drink it, what kind it is, and how your body reacts. Listen to your energy levels. Notice how you sleep. Pay attention to how your heart feels. Coming up next, we'll explore some simple, practical ways to enjoy coffee wisely so you can still get the benefits without overloading your heart. Trust me, it's not about giving up coffee, it's about drinking it smarter. What to watch for in seniors with heart problems. It's not one size fits all. When it comes to caffeine and heart health,
Not all conditions are created equal, especially for older adults. One of the biggest misconceptions I hear from patients is, well, if my friend with high blood pressure drinks 2 cups of coffee a day and feels fine, I should be okay too, right? Not necessarily. 1. Your specific heart condition matters. If you've been diagnosed with severe heart failure, uncontrolled hypertension, or irregular rhythms like atrial fibrillation, your heart may not tolerate caffeine the same way. In fact, even a small amount, say half a cup of strong coffee, can make your heart race, skip beats, or feel like it's suddenly working overtime. Let me share a personal story. I'm 72 years old, and for most of my life, I was a loyal 2 to 3 cups a morning kind of guy. Rain or shine, coffee was my ritual. But after I was diagnosed with mild atrial fibrillation last year, I started noticing something odd. On the mornings when I went for that 3rd cup, I'd feel this strange fluttering in my chest, like a fish flipping around inside. At first, I blamed stress, poor sleep, even dehydration. But eventually, I made a simple change. I cut back to just 1 cup, black, no sugar, no extras, and just like that, the fluttering nearly disappeared. So let me ask you something. Have you ever felt uneasy, jittery, or noticed your heart acting off after a big cup of coffee, especially when you were already tired, anxious, or hadn't eaten? If so, you're not imagining it. According to the American College of Cardiology, patients with arrhythmias may experience worsened symptoms after consuming more than 200 milligrams of caffeine. That's roughly 1.5 strong cups of coffee. And here's where things get even trickier. Caffeine may interfere with how your heart medications work. Certain beta blockers, calcium channel blockers, and antiarrhythmic drugs are metabolized in your liver, the same place where caffeine gets processed. When both show up at once, they can compete for attention. In some cases, this may either weaken the effect of your medication or intensify side effects like dizziness or heart palpitations. For example, if you're taking metoprolol, a common beta blocker, or amiodarone, often prescribed for atrial fibrillation, high caffeine intake might mess with how steadily those drugs work in your system. Even if your doctor hasn't specifically warned you about coffee, your body might still be giving you subtle signals, faster heartbeat, restless sleep, or just a general sense that something feels off. Bottom line, it's not about cutting coffee out completely. It's about listening to your body and adjusting your habits based on your diagnosis. If you've recently had changes in your medication, a new heart diagnosis, or symptoms you can't quite explain, try keeping a simple caffeine diary for a week. Track what you drink, when you drink it, and how your body responds. You might be surprised by what you notice. Coming up next, we'll dive deeper into how caffeine affects common heart medications, and more importantly, how to enjoy your coffee safely without putting extra stress on your cardiovascular system. Because, at the end of the day, you don't have to give up your morning ritual. You just have to make it work with your heart, not against it.
2. Coffee and medications, a hidden interaction that many seniors overlook. Most people know coffee has caffeine. Most know it can affect sleep or cause jitters. But here's what very few older adults consider. That same morning cup of coffee might be interfering with the very medications keeping your heart stable. Let's start with something simple. Diuretics, those water pills often prescribed to treat high blood pressure or heart failure. These medications help your body eliminate excess fluid, easing the workload on your heart. But here's the catch. They also lower your potassium levels over time. And potassium isn't just some number on a blood test. It's critical for your heart's electrical rhythm. Now imagine adding caffeine to that mix. Caffeine is a stimulant. It makes your heart beat faster and may increase the risk of arrhythmias, especially if your potassium is already low. You might not feel anything immediately, but over weeks or months, that combination can quietly push your heart toward dangerous territory. Let me tell you about my friend George. He's 74, a retired electrician, and a man of routine. Every morning, like clockwork, he had 2 large mugs of strong black coffee. No cream, no sugar, just pure fuel. George was also on a beta blocker and a diuretic, both prescribed years ago for his high blood pressure. Lately, he started feeling odd. Irregular skips in his heartbeat, occasional lightheadedness, and trouble sleeping. At first, he blamed it on age or stress. But eventually, during a regular checkup, he mentioned the heart flutters. His doctor ordered blood work, and there it was, borderline low potassium. The fix wasn't dramatic. George cut down to 1 moderate cup of coffee, added some potassium-rich foods like bananas and spinach, and after a few weeks, the symptoms nearly disappeared. He told me, "I didn't think coffee had anything to do with it, but now, looking back, it makes perfect sense." So let me ask you, have you ever thought about how your coffee habits might interact with your medications? Especially if you're taking more than 1 prescription for your heart, this is a conversation worth having with your doctor or pharmacist. According to a comprehensive review in the Journal of Clinical Hypertension, large amounts of caffeine may reduce the effectiveness of some blood pressure medications, especially ACE inhibitors and calcium channel blockers. That means your meds might not work as well as they should, leaving your blood pressure higher than expected, even if you're taking everything right. And it's not just about the type of medication, it's also about timing. For example, drinking coffee right before or right after taking your pills may alter how quickly the drugs are absorbed or how long they stay effective. But don't worry, you don't necessarily have to give up coffee completely. This isn't about fear, it's about awareness. Maybe it's just a matter of having 1 cup instead of 2, or waiting an hour after your meds before you reach for your brew. Because when you understand how caffeine interacts with your treatment plan, you're not just drinking smarter, you're protecting your heart in the long run. And speaking of smart drinking, up next, we'll break down exactly how much coffee is too much and why timing and quantity matter more than most people think, especially if you're managing a heart condition.
3. Your coffee habits make a big difference. When it comes to heart health and coffee, it's not just what you drink, it's how and when you drink it that truly matters. Many older adults, maybe even you, have developed the habit of brewing coffee strong and sipping it several times throughout the day. That mid-afternoon cup especially can feel like a comforting ritual, a little pick-me-up after lunch, a cozy companion during a quiet afternoon. But here's the truth most people don't realize. Drinking coffee after 3 p.m. may quietly interfere with your sleep, even if you don't feel wired at bedtime. And that's not just about tossing and turning. It's about what happens inside your body while you sleep, or fail to. According to a 2022 review in the journal, Sleep and Cardiovascular Risk, sleep disturbances are strongly linked to elevated blood pressure, increased heart rate, and a higher long-term risk of cardiovascular disease, especially in people over the age of 60. I'll share a story with you. I had a 70-year-old woman named Linda. Lovely woman, energetic, thoughtful, sharp as a tack. She never drank more than 2 cups of coffee a day, which is by most standards is perfectly reasonable. But her second cup always came around 5 p.m., right before settling in to watch her favorite evening shows. Her thinking was simple. It helps me stay awake and focused until bedtime. But night after night, Linda was waking up 2, 3 times, sometimes more. She felt groggy in the mornings, her blood pressure crept up, and her energy dipped before noon. So I asked her to make one small change. Move her last cup of coffee to before noon. Within a few weeks, her sleep improved, her mornings felt more restful, and her blood pressure numbers began to stabilize. So now let me ask you, do you often drink coffee after 3 in the afternoon? Even just a small cup? And what do you put in your coffee? Because this is another hidden risk. Many people aren't just drinking coffee. They're drinking coffee with sugar, syrups, flavored creamers, or even whipped cream. These tasty additions might seem harmless, but over time, they can quietly add hundreds of calories and dozens of grams of added sugar into your daily routine. And that matters. Excess sugar contributes to weight gain, chronic inflammation, and higher cholesterol, all of which add extra strain on your heart. As Dr. David Becker says, a well-known cardiologist in Pennsylvania, caffeine is only part of the equation. What's in your coffee and when you drink it may matter even more as you age. In other words, your heart doesn't just care if you drink coffee, it cares how you drink it. So here's a quick gut check. Are you drinking more than 2 cups a day? Is one of those cups in the evening? Are you sweetening your coffee more than you should? If you answered yes to any of those, it might be time for a small shift. Because sometimes just a little change in timing or ingredients can lead to a big difference in how you sleep, how you feel, and how well your heart functions. And now that we've explored how your coffee habits intersect with your heart condition and medications, let's bring it all together. In the next section, we'll cover a few simple, practical tips to help you enjoy your coffee safely and smartly as you age.
4. Practical tips from nutrition experts. So, how can you keep enjoying your morning coffee without putting your heart at risk? It's really all about making smarter choices. And let's be honest, that's something most of us get better at as we age. Here are 4 simple heart-smart habits that can make a big difference. First, lighten up your brew. You don't have to make your coffee extra strong to enjoy it. In fact, a milder brew is gentler on your heart and still provides the warmth and flavor you love. If you've been using dark roast or espresso every day, try switching to a lighter roast or diluting it with more water. You may be surprised by how little you miss the punch. Second, stick to 1 to 2 cups a day and keep it to the morning. Drinking coffee earlier in the day allows the caffeine to wear off before bedtime. This helps your body maintain healthy sleep patterns, which is crucial, especially as you get older. Poor sleep doesn't just make you tired, it increases blood pressure, weakens your immune system, and puts stress on your cardiovascular system. And finally, listen to your heart, literally. If you've been diagnosed with an arrhythmia or you feel your heart flutter or race after drinking coffee, consider switching to decaf. Decaffeinated coffee still contains antioxidants and flavor, but without the jolt that can throw your heart rhythm out of sync. Let me share a personal story. I'm 68 now. For decades, I drank 3 strong black coffees every day. No sugar, no cream, just pure Java. But after a routine checkup turned up signs of a mild arrhythmia, I knew I had to adjust. I cut down to 2 cups in the morning, and if I want something warm later in the day, I go for decaf. It may sound like a small shift, but I sleep better, my heart feels more stable, and I have more energy throughout the day. One of the leading experts in nutrition and chronic disease, Dr. Walter Willett from Harvard, summed it up perfectly. Coffee isn't bad. What matters is the dose and how it's used. For older adults with heart issues, coffee can be a friend, not a foe, when consumed the right way. So now I want to ask you, have you ever tried switching to decaf, at least in the afternoon? Do you pay attention to how much sugar or creamer goes into your cup? And most importantly, are your current coffee habits helping or hurting your sleep and your heart? These are small but powerful questions, because as you've seen, coffee can absolutely be part of a heart-healthy lifestyle as long as it's consumed with intention and care. Up next, we'll pull everything together with one final takeaway, a summary of the most important points and how you can take action today to keep your heart happy while still enjoying your daily brew.
So, what's the takeaway? If you're over 50 and living with a heart condition, coffee isn't automatically off the table. It's all about balance. Know your body, understand your condition, and talk with your doctor. That morning cup might still be part of your healthy routine. Did anything in today's video surprise you? Drop your thoughts in the comments. We'd love to hear your story. And if this helped you, give us a thumbs up, share it with a fellow coffee lover, and don't forget to subscribe to Health Tips 50 for more smart, senior-friendly health advice. Stay informed, stay well, and we'll see you in the next video.